Hi, I'm Dr. Kivett. I'm in Santa Rosa, California, and I'm a plastic surgeon and a dermatologist. And I wanted to talk today about the subject of interest here that you see in the press and other places. There's been some news lately that people are concerned about sunscreen causing problems, and I'd like to talk about that and sun damage. I had the experience while I was at UCLA many years ago to help the teachers there while I was studying at the medical center to help the FDA evaluate the value of sunscreens on 2 points. One was, did they help? And two, did they harm? And I have no association with any business or company that does anything with sunscreens, but I can tell you that we were able to show by studying hundreds of patients with lots of sophisticated equipment and statistical evidence that sunscreens are not dangerous, and in fact, they help prevent sun damage. In the past, it was said that there were all kinds of chemicals that were in sunscreens that caused harm, and if that's true, it certainly hasn't been true for several decades. The two types of sunscreens that exist are those that are more absorptive, and they are consisting of the benzone groups, although the name implies benzene. That has not been present in sunscreen for a long, long time that I'm aware of. They're absorptive. There's another type of a sunscreen, and that is it's a reflective sunscreen. So, one in particular, again, I have no particular financial interest in any of these things that I'm telling you about, is a sunscreen called Helioplex, Helioplex, made by Neutrogena. And it has a combination of both the absorptive and the reflective sunscreen. And if you remember the white lifeguard noses way back when they looked like they had mayonnaise on their nose, that's zinc oxide paste that really did absorb and prevent sun damage to the lifeguards' noses. Well, now they have a machine that does what's called micronizing, and it breaks up the zinc oxide so that it's almost perfectly invisible. No more mayonnaise on the nose. And it's absorptive. What the company did also then was they used the same machine to break up tiny pieces of titanium, which is metal. And so they're micro pieces of metal that are reflective mirrors. So between having absorption on the skin as well as reflection away from the skin is greatly protected by sunscreens like those. There's additional concerns by people about how sunscreens prevent other benefits, and it's just simply not true. Part of the reason that people have been getting vitamin D inspired sun exposure is that there's a belief, which is also a myth, and this comes from William Davis, MD, a cardiologist in Wisconsin and a nutrition guru with dozens and dozens of videos on YouTube that talk about how about age 40 and above, you don't really create vitamin D like you would in your earlier years. And so, subsequent to that, they've shown that much of our population has vitamin D deficiency, and therefore they encourage supplementation. Vitamin D is not a vitamin, it's a hormone, and it influences the body to absorb calcium in terms of helping sustain and maintain better bone growth. And it has other hormonal influences as well. So don't think of sun as helping your vitamin D levels. If your level is right at the bottom of normal, then you must show some concern and speak with your family physician about supplementing the vitamin D. It's difficult to get from a low normal vitamin D up to a mid-range unless you have substantial amounts of vitamin D, not tiny amounts. Again, speak about this with your physician. With respect to sun damage, by age 18, about 75% of our lifetime sun damage has been sustained, unless we have other jobs where we're working the entirety of our lives out of doors without a shirt on. Outside of that, the results of sun damage are seen, and that has cosmetic change, that has wrinkled skin, susceptibilities to rashes and itching and bruising and skin breakdown, and the most obvious concern, of course, skin cancer. And the things that come before skin cancer, that is, precancers. In other words, it's not like a light switch that suddenly goes from off to on. The skin slowly develops individual cancer cells, and then those cells continue to build up to eventuate in having skin cancer. The damage that we sustain as younger people and we continue to foster are those seen where clothing styles are skimpier now than they used to be. People have tanning beds, their desire to look tanned, outdoor lifestyles. The ozone layer is fading, which is normally protective. And in fact, people ignore the warning signs of skin changes anyway. In the past 30 years or so, the rate of fatal skin cancer has increased 400% in men and 800% in women. One person in the United States every hour does not get skin cancer. One person in the United States every hour dies from skin cancer. So every hour of the day and of the year, 370 people are actually diagnosed with skin cancer, much of that being treatable. The solution to this is behavioral change, and that's difficult to achieve, and for the reasons that I've already referred to. What people don't realize is that they think erroneously that as long as they're not out in the sun for 8 hours a day, they're fine. The problem is that they've done studies long ago. They had people that were involved in studies follow around who they considered to be indoor people. In one study, insurance salesmen, they said, well, insurance salesmen are on the phone indoors most of their life. And so they followed indoor people around with stopwatches, which is an old form of a timer now. And they found that the individuals that they were following had an average sun exposure totaling 17 hours of sun per month. And people say, how on God's green earth could we possibly have that? Well, you start looking at it, and you can see how it adds up. For example, if you go into a doctor's office, there's 1.5 to 2 minutes from your car. You go out and feed your dog in the backyard, take the trash out, go to the mailbox, go from your car into the mall. You can see how these individual 1, 2, and 3 minute exposures can add up. And in fact, that's what the study showed. That 17 hours, that accumulation is identical to your skin to laying out at a beach for 17 hours. There's no difference. So it's the cumulative effect. And so it implies that it would be a good idea to be protecting yourself from the sun. There's almost no difference in sun exposure of June versus December, about a 3% difference in incident radiation from the sun. And then if you start tossing in factors like fog and overcast, snow, cold weather, there's not a whole lot more difference. There's very slight difference. So to protect yourself, a hat is going to be important, especially a brim hat. I've had the particular experience of living in South America and in the Middle East for several years. And people will say, why do people dress like the way they do in those countries? On the Persian Gulf where I was, it was 135 degrees. And that's why people wear the type of clothing appropriate to the season. Thin cotton that you can't see through actually traps a cooler air underneath. That's why when you're in Phoenix in the summertime and you see people mowing the lawns, 120 degrees, they're doing it because they're cooler. They're not doing it for sun damage. Also, sweating then evaporates in the sleeve and it's cooler. If you take a drink, then the water will cool the sleeve as well by pouring a little on the area. Sunscreen is good. An SPF or sun protection factor of 50 helps a great deal, but it takes about 40 minutes to soak in, and it lasts about 2 sun hours, and is at best maybe a 50 to 60% block. So I particularly like to use sprays rather than creams because I don't like the feeling of the cream on the skin. Spray is more like a aftershave on my particular skin. And the studies show that if you spray it right in the middle of your face, a lot of it goes off to the edges and doesn't get where it needs to be. So I usually recommend to patients to put the spray on the fingers and then rub it on selectively, like aftershave. And then after a half hour, when it warms up from body heat, go ahead and just take a dry cloth and wipe off whatever excess that you would be concerned about running down through your eyebrows and onto your eyes. Sun damage is sustained, as I show you in this diagram here, not only to where my finger is pointing, the epidermis, the outer layer of the skin, but sun damage is sustained all along these hair follicles here, in addition to the outer layer of the second part of the skin, the dermis. So with that in mind, I can tell you that there are ways you can help yourself. This is a volume from one of our national organizations, edited by the late Dr. Mathis, volume 5, and in this there are discussions about a variety of things, both surgical and sun damage, and I've been asked to write, and did so, the chapter on management of non-melanoma skin cancer. And using the 789 references that my co-author had acquired for us, I can just show you a couple of things. So at the end of my finger, you see a well-oriented skin that starts at the basal layer and slowly moves up over a period of 2 weeks and then dies. And then the dead skin is held for 2 more weeks and then washes off. Over here at the end of my finger, you see the irregular cells that are few in number, along with a number of inflammatory cells that characterize this particular spot as what we call a precancer, although there are individual cancer cells in it. About 5% of these become squamous cell cancer. This is a diagram of not a diagram, it's a photograph of a 12-year-old boy who had a genetic deficiency of DNA repair from sun damage called xeroderma pigmentosum. And every single thing you see on his skin is a skin cancer. He's 12 years old here. He lived 3 more years and then died from the skin cancer. There are some ways that you can actually help reverse some sun damage in addition to preventing it. And this chart that we put together talks about a variety of ways that you can use creams and a light treatment that help revert the sun damage back to a much earlier state. It's not to say it's a cure, but it's certainly a major impact in terms of reversal. There are other discussions in this book in terms of the surgical techniques that I use on patients as well. But the issue today is sun damage as a preventive measure. So in the future, if you can do some things to help yourself, then you won't have to have a great deal of surgical change and aging of the skin. So, as the book says, even for the small children, play it safe in the sun. If you found this video valuable, please submit your comments and questions. We'll try to answer them. If you like what you saw, please give us a thumbs up. And if you'd like to subscribe, this helps us with other discussions on videos to help continue to educate the public. Thank you.